Hey everyone, and welcome to our latest edition of the Collateral Nation. Don't even know what episode on, but we're just counting up and up and up and up with episode after episode. So excited to have my co-host with me, Kevin Thomas Morgan. He's an incredible P.A.D. warrior, but also author. So make sure you check him out on Amazon. Kevin Thomas Morgan. Do a little search on Amazon, and you will find a wide array of books that may bring you a little bit more insight and inspiration. You can also go to inspirationalselfhelpbooks.com. Speaking of inspiration, find out more, sign up for his newsletter, and learn how he has been able to compete at a world's level in marathons in a triathlon, I think it was, right, Kevin?
Half Ironman
Even with
half Ironman race just
half
right now.
Ironman, even with P.A.D. blockages from groin to toe, and how you can do that too, if that is your goal. Even if it's just walking from the bed to the bathroom or to the mailbox, Kevin's techniques may be able to help you. Right, Kevin?
Yeah, that's right. My main blockage is my right and growingly my left popliteal artery, though I know there are problems elsewhere and higher already, because this thing is progressive. And the only real way, once you've gone beyond stents and other surgeries, exercise is the key to grow collaterals wherever you can. And while you're working on collaterals, especially for your feet and calves, it also helps grow collaterals in your heart. And as people with PAD have a tendency to die of heart problems sometimes, in fact, I understand 70% of the time, then doing these kind of exercises makes a huge difference. I have no dorsal pedal pulse in my right foot, which is a major blood supply for toes and stuff, and yet I have normal O2 sats because of collaterals. And so Kim's program really encourages people to focus on walking. You have a lot of really great people here who can encourage you along the way as inspiration.
Yeah. And that's why we do this every single week. I mean, it gets, especially, we're going to be here all winter with you through the fall, through the winter, because we know it's the toughest time to get motivated to walk. It's cold outside right now. We have our first major storm of the year in California. So thank goodness I have a walking pad. You don't have to ever pay full price for a walking pad. You can actually go on to Facebook Marketplace. And typically in most neighborhoods, there is one. I've seen them for $25 to $50. And if you can't afford the $25 to $50 and you have one in your neighborhood, then call us here at the Global P.A.D. Association, and we'll see if we can help get you one that's from your neighborhood and at a lower cost and easy to maneuver and get into your house or your apartment or wherever you reside. But it's really important to walk, grow those collateral vessels. You can see with Kevin and his example that if you literally work at it, you can grow enough collateral vessels to sustain your legs. And if you do have a blockage behind your knee, one of the vascular surgeon told me it's the best place to grow those collateral vessels. Lots of collateral vessels can grow from your thigh to your calf. So don't get freaked out if you do have a blockage behind your knee. It's one of the toughest places to do procedures on and have it be sustainable. They do have some flexible stents such as Sapera, which are advances in care for PAD for popliteal blockages behind the knee. But it's always best and most durable if you can grow those collateral vessels, because that's how God made you.
Anyway, Kim.
Or however evolution made you, however you believe.
Hey, Kim, I asked back in 2015 when I was diagnosed with an ABI, I was already having symptoms for over a year.
Yeah.
I asked my vascular surgeon, Mark Farber, who's really a great surgeon. I said, can you put in stents or do angioplasty? And he said, Kevin, I strongly advise you about any kind of treatment right now below the knee because you risk losing your leg. And I've read of people who actually have lost their legs due to that. So you need to be very, very careful about considering stents or surgery below the knee, according to my surgeon, Mark Farber. And he gave me good advice. And of course, now he recommended growing collaterals, and that's what I do. I'm afraid I'm a little dark. The sun is, I'm taking this call from my truck, sitting outside of a Panera where I was working and forgot the time. and the sun is behind me, and I can't do anything about that. But I've got this computer running on battery from my solar panel on the roof of my truck, and so is my Wi-Fi, which is a separate Wi-Fi. I never trust public Wi-Fi, by the way. That's another topic that's interested me a lot. Anyway, yeah, that's it. Never give up. But a lot of the problems are mental. I mean, the physical is. There's a great quote by Nietzsche: "Anyone who has a why can always overcome a how." And so why what? Why you want to keep your feet, right? You want to live into old age and enjoy it as long as you can. And how do you do that? Well, determination, and also understand your situation, understand your anatomy, think it through. Don't trust people blindly, including me. Understand what you're doing, because you are your best physician. Okay, over to you, Kim.
I think that's pretty good. I want to go back to I love the why. The why actually drives the how, right? You can overcome any how with a why. And I
Yeah.
think that that is incredibly powerful. And I think keeping your feet is a pretty powerful why. And I think that, um, oh, we had a friend here just a little bit ago, and she's been struggling to stop cigarettes. And she does have a why. She does want to do it, but she hasn't, you know, it's not powerful enough yet to overcome the how. She needs to stop smoking, because smoking can cause your vessels to spasm, and that can restrict blood flow to your feet. It also damages your artery walls, causing plaque to build up on your artery walls. So yeah, definitely make sure that's your why needs to be powerful. I mean, keeping your feet should be a powerful enough why to get you to not only stop smoking, but also to get you walking. But you were mentioning that you had the below the knee disease. And back, when did you talk to Dr. Farber? That was quite a few years ago, where he said that the below the knee treatments were not good enough, or durable enough, that the only way that you could actually overcome this and persevere and keep your feet is if you don't have a procedure and you walk, 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 or else it's just going to be a revolving door of procedures to try and treat below the knee, leading you closer and closer to the amputation, because there's only so many procedures you can do, because with every single procedure, it causes trauma to the vessel. Um, and back several years ago, I would even say just last year, there still is no 100% durable treatment, but treatments have advanced. You do have two new options for below the knee. Abbott has a new bioabsorbable stent, which is increasing patency rates for below the knee treatments. They are coming out. They have a short one right now, a short bioabsorbable stent, and they're actually going to be releasing at some point a longer one. I'm waiting for that, which would be great. But the other one is from Reflow Medical, and they have a retractable stent. And the stent has little spurs on the end, just as a stent would. And it burrows into this side of the vessel, and you can inflate a balloon in there and then bring the balloon down and leave the stent open for a few minutes to allow the blood to go through, get used to, more lumen, the luminal gain in there with the balloon. And then they take the stent out. So it's a retractable stent, and they're finding some really great success in patency rates, 6 months to a year with that as well. So a lot of new technologies, but still, even with these new technologies, they're great. They do improve patency rates, but they're not as durable as your own collateral vessels that you can grow through walking with medicine. Walking is still the only durable mechanical method, right? If that's the best way to say it, Kevin, of keeping your legs if you have PAD. So walking does need to be almost a full-time job, or at least a part-time job for you. You got to do it every day. I know they say that 3 days a week in a supervised exercise therapy program can be impactful, and it can. But if you can walk 5 to 7 days a week, you should be walking every day. You shouldn't be sitting on your butt, 2 days out of the week on Saturday and Sunday and doing absolutely nothing. Do your cycling. There's my dad behind me, and he's got me some coffee, and now I'm double fisted. Look at this. Thanks, Dad.
And you got to, don't forget when you finish this, yes, everyone.
And he's letting me know that we have some workers coming today. I forgot, I think our dishwasher is not working. So I'm not only working my feet, but I've been working my hands a little bit more, washing lots of dishes.
Anyway,
Anyway,
Kim,
so
you asked me a
it's a little
question.
distraction. Yes. Thank you for bringing us back, Kevin.
Yeah, so yeah, well, I testified in court a few times. I learned a few tricks. Anyway, you asked me about when I first asked Mark about angioplasty or stents. That was back in 2015, following
Mhm.
my first ABI, and I saw him only 6 months ago, and he hadn't changed his mind. And he's conservative, and I imagine he would like people to test it out on other people's patients first to make sure it really works. I'm not saying he said that, but that's my suspicion.
Yeah,
And
some
so,
doctors don't practice medicine. They just wait for other doctors to create the evidence. And when there's enough evidence from practicing medicine, then they will adopt it. So
yeah, I think he should better have given me the choice and told me what was out there. If he had that procedure available in his facility, which he may well do. But yeah, I can also understand people being conservative when people have lost their legs with these techniques. It's a difficult call, really. Judge not, lest thee be judged, right, Kim?
yep.
Anyway, yeah,
And that's
it's
why we always say get multiple opinions. But in your case, I mean, you got to think that in some cases like yours, I mean, everything's meant to be. And because of the way in which Dr. Farber guided you, and he guided you with the most durable option, he knows your personality. He knows you're not going to want a revolving door procedures. And at this point with your disease, right, as you express it, it would become a revolving door of procedures. They say as soon as you have the first procedure, you're just setting the clock. The clock restarts every single time you have a procedure. Now, there are people, and I don't want to tell people don't have a procedure, because you do have patients that are a toe stub away from amputation. Literally, the diabetics, people with chronic kidney disease, sometimes they do not feel the symptoms, Kevin, in the same way that the textbook PAD expresses them. They don't actually experience this same type of claudication. So we say you have PAD and you have it when you walk, you feel some sort of claudication, some sort of pain, some sort of fatigue when you're walking. And when you rest, the pain ends up going away. And so then you start walking again and it starts all over again. You start walking and the pain comes back. But sometimes people with the diabetes and chronic kidney disease have this neuropathy and they don't feel it. Theirs is more of a bottoms up disease. Yours was more of and a lot of people have it from a top down. So they have a bigger vessel disease that comes from the top down, from the abdomen down to your knee, the bigger vessels. But then the diabetics and the chronic kidney disease patients have this bottoms up, smaller vessel disease only for the most part. And that one is where we say you really need to make sure and ask your doctor at this point, do I have time to walk for 3 months, or am I a toe step away from amputation? Because as soon as that wound appears, those wounds are so tough to heal, so tough to heal, and they can turn very quickly. So you need blood flow to heal those wounds. But needless to say, that you should be in the habit of walking no matter what. You have PAD, even if you haven't been diagnosed with PAD, that you have the risk factors. You have smoked, you have an autoimmune condition, you have heart disease, you have chronic kidney disease, you have diabetes. You got to start walking now. Protect your feet and start walking today to start building those collateral vessels.
Kim, I think before people say consult your doctor first. I disagree. I think you are your best doctor. Your doctor is just a tool in your toolbox, as is your surgeon, as is your body movement teacher, whatever. If you really want to fight this condition, you need to understand the condition itself, the disease and the cause, and your manifestations, because we are all different. You then integrate that with your background, whether you're used to exercise and not used to exercise, work out a plan, and then consult your doctor, but not just your doctor, maybe more, or one or two or three different people give you different opinions if you can get them. You might want to, if you can afford it, consult a body movement expert who can help you improve the way you move to make it more efficient. But at the end of the day, the buck really stops with you. I mean, the doctor sees you for 5 minutes, and maybe as a surgeon, he sees you conscious for 2 minutes, and he doesn't really know your body like you do. So once you start really listening to your body, treat your physicians and surgeons as tools in your toolbox, essential ones who've saved my life several times, but it really does end with you. And once you leave the door of the hospital after the surgery and they say, we've done what we can, then it's up to you to step up and literally step up and do the work that's needed. And if you come to groups like this, you'll get a lot of input from other people who've gone through it, other people who are struggling, even people who are really upset by the whole thing. And so you have community, and community is critical for conditions such as this. So, yep. But you've got to understand your condition and what it is personally, and spending a little of time learning that really, or asking questions in places like this is a good place to start. Okay,
And we
Kim.
have Karen that's here that actually she and I we've known each other for a couple of years now. And when we first talked, I said the best thing you could do is talk to your doctor about a supervised exercise therapy program. And Karen, you can go ahead and unmute and join us. Remember, if you are watching at home, you can actually join our live studio audience. Just make sure to email info@padhelp.org. Also, like the video if you're watching on YouTube, subscribe to the channel. We do this every single week, and you can get notified and just be a fly on the wall on YouTube. But we have our amazing producer, Josh, who's there with you on YouTube. And so if you comment or have questions or anything like that, he's going to make sure that you get involved in the discussion and we can answer your questions and relay your comments to the grander audience as well. But Karen, thanks so much for your courage and being here, sharing your story, because we're here to help you, but also through your story and this entire conversation, we're helping others as well. But Karen, talk to us about what you have going on.
I've had difficulty walking, intermittent claudication since about 2012, 2013. I went through a number of different diagnoses. It was neurological, then it was my spine, it was my hip, and none of the treatments helped. So I finally was diagnosed about 3 years ago with P.A.D. During this entire time, since 2012, I have walked about 45 minutes every day on the treadmill. Since I've talked to you, Kim, maybe 8, 9, 10 months ago, I have walked to the point of pain and then stopped and rested and gone back with the pain. Gone back again. I did just.
So are you walking, Karen, to the pain? Like what level of pain are you stopping at?
At home, I was stopped. I think it's pretty severe.
Okay.
Now I don't.
So you're not.
Go ahead.
You're not walking to the pain and stopping. You're probably experiencing some pain, right? You acknowledge that you have some pain, but you're pushing through that pain to the point where it's severe and then you're stopping.
Correct.
Is that my understanding? Okay.
Correct. Now
you're doing it right.
Interestingly enough, you should say that because I just finished a 12-week rehab session at our local medical center. And their protocol was that you stopped when you were at moderate pain. I think I still went a little beyond moderate, but the reason I'm here today is this walking program at home and at rehab. And I just didn't do rehab. I still walked every day. Maybe one day a week I would take off occasionally. I walked every day. Has done absolutely nothing for me. In fact, I think that I've gone backwards a little bit.
Can I make a comment here?
Sure.
Okay, when we talk about, we need to clarify pain. People talk about a 0 to 10 score. That makes no sense. 0 to 5 is the most our brain can actually have a reasonable difference or discriminate between the levels. My system, which I use, and I have stuff on my website showing data I generated using it, 0 is no pain. I'm talking about when I'm walking. A level 1 is discomfort. A level 2 is clear discomfort. It's like really clear discomfort. Number 3 is I'm starting to have some actual pain. Number 4 is very painful, but it's not interfering with function. When blood supply to your calves and feet interferes with function, your feet will tend to slap the ground, and that can bruise the balls of your feet. And you don't want that. So once you get there, then I call it a level 5 pain. And if I take it to level 5, I will have to stop within a couple of minutes. And then I wait for it to return to a level 2, which is clear discomfort, but not actual pain. But it's clearly just uncomfortable, but the muscles are getting the blood they need, but not really enough to fully recover. What's that beeping? Is that me? No. Anyway, so I think it's really important we have a standard definition of the pain, and that should be laid out. We don't need to do that now. My recommendation is if you get to level 5 and you start to bang your feet against the ground, you don't want to be doing that. That's going to damage it's going to bruise your feet. So you have to kind of get a feeling for how far you can go. Now, and also you don't want to return to 0 pain. I mean, that's a really big mistake. You're losing training time. I mean, you want to keep training. So I bring myself back to a level 2, which is, which really works. And there are graphs on my website about that. But number 2 to remember is I discovered my P.A.D. when I was running marathons and doing full Ironman races. Well, if I was doing marathons, well, I still got P.A.D. That suggests that just walking is not enough. And so I've been researching that ever since. And what you really need to do is improve the way the blood flows through your feet. And we can talk about that if you like. And there are ways of doing that, engaging your feet. So if you want me to expand on that, I can, Karen. But I think
believe I know what you're talking about. Is that your 100 things before you get out of bed in the morning?
That's correct.
I do those. I do not do 100 yet, but I do about 50. 60.
Yeah, 50 is good. Actually, 100 is pretty tough. You have to be really ready for 100. And it will start making usually my tibialis anterior will start to get irritated or cramp up. So you're actually doing that. Are you doing that while you're walking?
No, I do that before I get out of bed in the morning. I'm not doing it when I'm walking. No.
Well, that's the key. That is the trick is if you go through the process I describe in those videos, you have to get to the point you can do it while you are walking. I mean, if you have a pump and it helps blood flow to your feet, and then you stress your feet by walking, well, you need the pumps even more. I mean, I created this idea because of my background as a veterinary pathologist and learning anatomy, physiology, whatever, but also have a background as an athlete. And I see this as endurance training interrupted every now and then by intensity. And so if you train yourself to do something like getting out of bed doing the P.A.D. 50 or 100 or whatever, that's great. But you have to incorporate it into your walking because you want that pump to keep working. And this is the tricky part to learn. You have to do it gently and smoothly. And I think we could maybe readdress this again at another meeting. There's videos I've created that clarifies that. But it's a kind of a mental thing. What you're doing is you're stroking the ground with your foot to contract the muscles in your feet and calves to drive the blood out of your feet and up towards the veins in your calves. And then once that's emptied, the real trick is you have to spread your feet and relaxing your feet. And relaxing at that point is critical so fresh blood can flow into your feet. If your feet are tense, that's not going to happen. So this is the tricky part, I'm getting a lot of messages about help. I don't know if it's effective. Can you hear me okay?
Yep.
I can.
Okay, that's the
Yep,
main
you're
thing,
all
Karen.
good.
Oh, okay. Thank you, Heinz. Anyway, the hardest part for me to learn, first I had to invent the damn thing because I didn't find it anywhere online. I mean, I realized if I got PAD while I'm running marathons, do you think walking is going to fix it? My surgeon said walk 3 times a week for 30 minutes. I ran a marathon 2 weeks later, but I finished it in 7 hours. I mean, it wasn't rocket science to realize that just walking wasn't enough. And I had to, while walking, improve blood flow through the critical part of my limbs. I also protect my arms too, because I do these exercises with my hands because I don't want to lose my fingers either. And there's a risk there. It's less than the feet, but it's still there. So the trick, Karen, is somehow take what you've learned. Remember to focus on that spreading and relaxing to get blood back in your feet. Don't expect it to happen overnight, but now I'm able to, I am able to, with difficulty, finish half Ironman races with difficulty. But my real goal is to get back to full distance marathons and Ironman. And, you know, if you aim for the stars, you might get to the moon. If you don't have a dream, how you have a dream come true. That's what I think about this stuff. And so you're doing great. You've learned the P.A.D. 100. I don't know whether you're doing it correctly. That is critical. And the hardest part is easy enough to flex your feet, but it's quite difficult to lift your foot and spread your toes. That's a really tricky part, but that's when you let blood flow in. You will let the blood flow in by relaxing. And what happens to your heart after it's contracted in systole, it relaxes. And I'll tell you an interesting thing about the heart. Your body receives the blood, the driven blood, during systole, during contraction. Your heart receives the blood during diastole as your heart relaxes. Now, if your heart didn't relax, it couldn't receive that blood. And where did it receive that blood from? Well, the mitral valve slams shut. And now the aorta, which is elastic, this is the worry with aortic arch stents to me. Your aorta is now storing all that energy in the elasticity of the aortic arch. And that is what drives blood into the heart during diastole or during cardiac relaxation. So the more you understand this and how your veins are, you know, storing energy and have valves, how muscles are pumps, how all the arteries in your body are acting as pumps by storing the energy and giving it back when needed, it really helps. So you're doing the right thing. But when you said you're not doing it while walking, well, that's like, well, you know, my bike goes great on the trainer, but when I get on the road and I stop pedaling, it stops. It's like that. It's that kind of, I don't know if that's a useful metaphor.
I'm actually trying, I'm walking right now. I'm on the treadmill right now.
Yeah.
And I'm trying to do it while I'm walking. Is there something, a little hint you can give me?
Yeah, start by just stroking the ground with your toes as your feet hit the ground. And there are other aspects to this that never get talked about. Number one is walking with your whole body using elastic recoil of the spine. I mean, I could almost run a 1 hour or a 1 day course on this damn thing. I mean, it's essentially you're trying to engage everything in your body you can to A, drive blood to and through your feet, and B, to minimize the load on your feet by engaging the rest of your body. I mean, I've been studying this. I mean, here I was born during a war. I had rickets as a kid. I got some scoliosis, weak bones and joints. But I fortunately went into pathology. So I don't have some major physical advantage over anybody else, but I do have a mental advantage in my interest in science. And that's what's allowed me to do what I'm doing. And you can do it too, Karen, but you have to start off changing things gently. So I would say start by gently stroking the ground, which is what I initially did with your toes. Just walk normally, but just think about very, very gently stroking the ground with your toes. And when you stroke the ground with your toes, you're doing two things. You're activating the muscles in your feet, and you're contracting your calves, which is compressing the veins, which is improving venous return. That's where I started. It took me 3 years to work this thing out, but now I worked it out, and it's really working. But you're exactly on the right track. And you've noticed you're not making progress. You know how few people even notice things like that? They go off to the pub and have a beer instead and complain. Well, that doesn't work. I tried that. It didn't work very well. That was kind of a pity. I did enjoy the beer at the time. Anyway, excuse me, joking. And so, Karen, start by gently stroking the ground with your toes, and then let's meet next week and you tell me how it went.
And can you just explain stroking the ground with my toes?
Well, yeah, well, let me see if I can
show me with your hands. Show me with your
Yeah,
hands.
I will. Okay, here's my feet, right? I have my feet in shoes. They're locked in shoes. I never use them. Clomp, clomp, clomp until boom. Then they hurt. My calves are clomp, clomp. And then I start trying to learn how to do this thing with my feet and grabbing the ground and spreading my toes and grabbing the ground and spreading my toes, which is what I do. and there are videos of that. But I didn't start there. I start by, how do I manage to use my feet while I'm working with the ground? I'm having a conversation with the ground. My feet are talking to the ground, and the ground is replying. If I go clump, 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 the reply from the ground is bang, 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 hurt my feet. So what I do is I come in from the side of my foot, because you want a low impact walk, which means using your shoulder hip counter rotation. So they come in, they don't just land on the heel. That's a huge mistake. They land in from the side, but you learn these things one at a time. But I would say walk as you are now, but as they get to the ground, just imagine just stroking the ground gently as they land on the ground, but just imagine stroking the ground rather than hitting the ground. But start with your toes, and then after a while you can do it with your whole foot. And then after a while, you're so comfortable with that, as you lift your foot away from the ground, you then spread your foot as wide as you can, but you do it in a relaxed manner. The whole thing must be relaxed. Blood does not flow well, or tissue flow well through tight, tense tissues. That's why you get rid of small toe box, you get rid of tube socks, because you're trying to relax, like your heart relaxes to let the blood in, right? And it has to let the blood in from the aortic arch, where this blood is stored to go into the heart arteries. So your heart relaxes so it can receive the blood. I mean, you can almost talk about this in terms of religion if you want. You have to be receptive. Your foot has to be receptive to the blood. And that's the hardest part for people to understand. But you start by first gently stroking the ground. And then once you're comfortable with that, then you start by focusing on spreading your feet. And you use the yoga toes so you know what spread feet feels like. And so you do that. And then after a while, you get to contract your whole foot. And then you try to master low impact walking, running. And you can watch the videos of Danny Dreyer or read the book by Jack Heggie, which is how I did this years and years ago for running. So I would say start there and focus initially on just stroking the ground, relaxing your foot. And as your foot lifts, just try to spread those toes a bit, just a little bit, just a little bit, everything's little and often. You have to learn 10 or 15 things, but you learn them one at a time and you stay relaxed. That is essential. The problem is when you learn something new, what do we do when we learn something new? We tense up. So it's what we do. So it's like learning to ski. If you want to stay on the mountains, lean out from the mountain. If you lean in from the mountain, you lose the edge and you slide down the hill. It's that kind of counterintuitive thing. Does that help at all, Karen?
I think it will, and I'll try it out. I was walking when we first started the conversation, but I had to get off because I think my pain was about 5. So I've been listening very carefully to what you said, so I will give it a whirl.
Yeah, I remember it took me 10 years to master body movement sufficiently to do a full Ironman. 10 years with 2 knee injuries. I mean, I didn't know what I was doing. I was a water polo player. How much running do you learn as a water polo player? Not a whole lot. And so it took time. But how old are you now?
About the same age you are, I think, since I was born. I was the first child born in the United States after World War II.
So you were born, when did World War II end in America? For us, it was 1945.
45. I was born in 46. I just turned 79 last week.
Okay, so you're 3 years younger than me. So you're really a spring chicken, Karen. Because the problem is,
you really are.
Entropy accelerates exponentially. It does not accelerate linearly. That's why it's such a pain. But yet, no, the fact you're here talking about it means you have a really good chance of walking a long way and having a good time. And you're approaching it by thinking and asking questions. And you're probably asking the only people who have a clue about this stuff, because I've not met anybody else who.
Well, and my concern is I feel that I have been walking for 10 years and I've had moments of improvement. I had 6 months in 2019 where I was like a normal human being again.
Well, my walking never got better until I learned. It got a little bit better, but not much with all the other things I did. But the true change was when I worked out how to change my feet into pumps and how to get this thing to work while I was walking. And now I'm getting it working while I'm running, which is like 10 times harder because it's faster and it's more prone to impact. but you were walking for 10 years, but you weren't walking using your P.A.D as remote blood pumping stations. And that I
Probably
think is,
not.
well, I was running marathons and still got P.A.D. So clearly walking on its own isn't enough, and changing the way we move is key. So you're doing the job, you're walking enough to actually learn it. Now apply the method, maybe watch my videos again. I've got one on there that specifically describes how to turn your feet into blood pumps. And then it's some of these things are so hard to describe because a lot of them are feelings. Go rewatch those videos, call in next week and ask questions. Next week is Wednesday. Yeah, I'll be on the road. Yeah, I'll be at Sue's house on Wednesday. On Wednesday week, I'll be on the road again doing this. So I'm in my truck. It's about 500 degrees in here now because I can't open the windows because of the noise of the traffic. Anyway, yeah, no, I'm really pleased you're doing this because it gives me a chance to test what I'm talking about. I mean,
Kevin, I'm sorry, where do I find your videos? I
oh,
think I've
there's
seen
actually,
some, but
if you go to my, were you one of the people who got my training plan?
I don't think so.
Well, if you get
No,
the training plan, I don't know how much the ebook is, but it's not much. In there's it talks about links, or you can just go to my YouTube channel, Fit Old Dog, YouTube at Fit Old Dog, and on there is a P.A.D playlist. And that playlist contains 33 videos I consider relevant to fighting P.A.D. And they're free. You can just watch them all or watch them as you feel like. And one of them is how to turn your feet into remote blood pumping stations. It's like a 2-minute video where I describe the process. Now, describing it and writing about it are, kind of one thing, but learning how to do it. I mean, I said the flute for 10 years. I mean, there were certain things I never learned to be able to do. Some kids could do it when they were 7. So it's a learning thing. But if you can start by stroking the ground to contract those feet a bit, and then you can learn to lift your feet and relax them and spread your toes a little bit, then you'll be able to see if there's a difference, which is what I need to know. Can I teach people to learn what I learned? And that's the hardest thing for me because I'm a scientist, right? I had to use an app to take the long words out of my, out of my papers because I was using words people didn't know. We all know different things, right? I mean, I can
and
talk to a
Karen, um, so actually, I don't have PAD. My grandfather did. He actually died of an infection from aortoiliac disease, which is a type of PAD, a different classification of PAD, and he had his aorta replaced with a graft, and the graft was infected, and ultimately that spread, and he passed away. Which is why it's really important for me, for people to spread the message that your walking needs to come first, procedures second, because it's near and dear to my heart. Not that my grandfather um didn't need this procedure. I mean, it was his aorta, so of course it was likely that it needed something. It was fairly blocked. He was having rest pain at night, and he was out in the garage area pacing into the wee hours of the morning. But needless to say, that's why this is so important to me, to get the message across that if you can walk and you can't avoid a procedure, it's really important to take the most durable route, which is walking as medicine, to build those collateral vessels. But with Kevin's methods, I actually was starting to have hip pain when I was walking on my treadmill. I'd never walked on a treadmill before actually starting this Collateral Nation program, because I wanted to be able to walk while I was doing this, so I could inspire other people like you. And also Mike's out there walking. Mike's in our live studio audience. We just got to get Heinz walking as well. I think Douglas is doing some wood burning out there, but he gets in his steps during the day. But needless to say, I want other people to join and walk while they're actually here and have a little accountability. But my hips started bothering me, and he taught me exactly what he's telling you with his walking method with the toes. And it's not literally clawing, which I was doing in the beginning, which didn't help. But now I'm just kind of, it becomes a habit, right, Kevin? Where when you first start doing it, you don't even you have to really concentrate on it. And I used my hands. And even now, as I'm using my hands, I can feel my toes doing the same exact thing that my hands are doing. So Karen, you can use your hands first. Just do as I'm doing right now, which is to actually, just claw a little bit like this, but not claw, not grab. But I don't have any more hip pain. I could literally walk at a pace of 3 miles an hour by doing this with absolutely no hip pain. And it feels good when you're actually moving your toes like that. You can feel it in the top of your foot. You can feel those muscles working more effectively versus just kind of, I don't know, when I now don't do it, like right now I'm not doing it, I just feel like I'm kind of slapping my feet against it. But this really feels good. It feels like I'm getting even more of a workout. And I can feel it in my calf too. So I feel like it's giving that extra, that second heart, which is your calf muscle, a little bit more of a workout. And I think you're gonna love it. You'll even start doing it when you're sitting or even when you're standing. You'll do this with your toes. I do it when I'm in the car on long car drives or even on the plane. It feels really good. And I almost feel like, Kevin, we need to do just a study. And I don't know how we could do it with that alone, just doing that alone, how much of a difference that could make in the collateral vessel flow into your feet? Because I can certainly feel it. I feel it so much more with that than with walking alone.
Okay. Thank you.
Yeah, we just need people to try it out and see if it works. And getting studies done and all that kind of thing in the current climate might be tricky. But anyway,
Mike is here. Mike is doing that. So Mike does the P.A.D. 100, which we haven't really talked about in this episode. But Mike, do you do that? Have you been able to master? You're out there walking. You did a 13K. You went from barely being able to walk across your house to going a 13K in a matter of months through working through Kevin's program with the P.A.D. 100. But are you doing this technique when you're walking?
To be perfectly honest, no. I have been doing it now on this walk today because we've been talking about it, but for some reason I don't do it religiously. I
Yeah.
do an hour of 40 minutes on the treadmill every day, and because I try and intensify my workout, so I do a lot of treadmill. So trying to do that as well as the running, it's I find it quite difficult to get the process of it going. But apart from that, yeah, I do the P.A.D. 100 every morning still do that every single morning. So
well, the thing is, Mike, if you're doing that every morning, your body is listening. And the chances are your body is probably still doing it to some degree, even if it's subconscious, because your body listens and learns. And as a general rule, your body is more intelligent than you are. I'm not talking about you personally, I'm talking about humans. And so our body is very wise. It stores a lot of feelings, a lot of new things. It also is very slow to learn new things because it thinks it knows best and it has to change. But the chances are just doing the P.A.D. 100, and you don't have to do 100, you do 50, it doesn't matter, but doing it right. The most important part is the spreading after the contract. That spread after the contract.
yeah,
That is really, really important. Because think about it, if your heart contracted but never relaxed and spread, how would it ever get any blood and how would you exist? So the inaction, like it says in the Tao Te Ching, which is really a pretty remarkable book, considering how old it is, it's in the inaction that the action occurs. It's in the relaxing that you get the blood in your foot. And so you've got to balance those two. But you've made remarkable progress. I'm kind of surprised how much progress you've made in the time you've been doing
yeah,
it. So you've really been working.
Yeah.
yeah. I work out every single day, and as soon as I finish the treadmill, I'm always out on a walk every single day as well. So
Yeah.
I'm
You're
I'm
a
trying my
youngster.
best to beat this.
How old are you, Mike? Are you 25?
I wish. I'm 44.
Oh, you're just a kid. My youngest kid is 52. Come on. Youth helps. Youth helps with everything. It makes everything much easier except for wisdom. That doesn't come so easily when you're young. So
So
that's
I'm
great.
wondering,
Oh, there's Karen. Hi, Karen.
there's Karen.
I
Hi,
just,
Karen.
I
It's
did
so
not
good to
put my
see.
makeup on today. I wanted to see what I look like without my makeup on.
You
You
look
look
better
great.
without your
Not too
makeup. Much
bad.
better. No, you look much
I
better
didn't
without your
either.
makeup.
Karen, my dog had a tick this morning, so I didn't have a chance to put on anything more than eyeliner this morning. So I'm
Well,
with you
that's why I
100%.
was thinking
Could
you
I
look
just
quite good. Yeah. So
You
I
look
need to
great.
go. I need to
could
go
I
pick up
just
a prescription So I am going to leave, but thank you so much for all your information. Kevin, I will be looking at how many videos. It'll probably take me a while to get through your 100, but
You
I'll
don't,
do
you
my
don't, you don't,
best.
yeah, there's only 33 videos on that list.
Oh, okay, 30,
But
the
I,
100
I,
is toes. Okay.
yeah, I would say there's one called How to Turn Your Feet into Remote Blood Pumping Stations, and the other one is Low Impact Running. That's worth watching too, because it will change the way
Yeah.
your whole body moves. I learned that from Jack Heggie, who was a remarkable Feldenkrais instructor and runner.
And we have a demo going on here. Do you see this? Doug is
Yeah, we
giving
have
a,
actually Douglas that's over
Yeah.
there. Look at he's
yeah.
doing his, but for those of you who can't see, you always have to join our live studio audience at info@padhelp.org. Make sure you email us and get in the live studio audience because we have Douglas out of Texas. He's doing some foot exercises in our live studio audience. And you know, while you're sitting, you should always be moving your feet as Douglas is. I'm not sure, is he trying to do the PAD 100, Kevin? I can't
I
tell.
think so. I think so.
Yeah, basically, I do it alternate feet. I alternate my feet as I walk. I imitate. He's doing it with both feet together like this. I do it with like as I would when I walk. But first, you have to
Okay.
master the spread. So you can start both feet together, but then you need to do it alternately, which is how you walk, right? You don't walk. I mean, you could hop, I guess, like a kangaroo. I imagine kangaroos should do it like that. But anyway, that's just a thought.
Okay.
Yeah.
Bye-bye.
Thanks,
Thank you
Doug.
all.
Karen,
Okay,
I hope that
Karen.
helps.
Thank you.
And you're welcome. And Mike,
Oh.
you were raising your hand. Hi, Mike. Mike's back. Mike is done with his walking. I can't tell, Mike, if you
Sorry.
are at the supermarket or if you were walking home. You're at the supermarket, aren't you?
He's
Come on.
I think
frozen.
he's
Yeah,
at
I'm
the.
just getting a drink from the wall.
Anyway,
Oh,
I
good
have
for you.
I have a
You hear
question,
me?
Karen. I have an important question.
Except Karen's gone.
No, important question for you, Kim.
Oh,
Sorry.
for me.
What the hell is Heinz thinking? He's not saying anything. He's making me nervous.
I know Heinz always makes me nervous because he comes and you know he's always thinking. He's very analytical as well. But when he comes up with a statement or a question, oh, it's a doozy. Right, Heinz?
I walked this morning already. I was up at the crack of dawn walking, so
You do it every morning, don't you? You know who were your ears burning lately? I was talking to Dr. Aaron Armstrong, your doctor.
I saw him
He's
last Monday.
he's always so impressed with you. And actually, you know, thanks to your help, he was able to help another patient who had a similar situation with radiation damage to the arteries. And the other doctor, you know, bless the other doctor's heart, they wanted to go in and they wanted to not only open the iliac artery with a wire and balloon, but then they wanted to go in and do a full endarterectomy of the common femoral artery.
Right.
And they hadn't even tried going in there with just a wire and balloon just to get the lay of the land. And so she got a second opinion, you know, thanks to your help and encouragement. And you know who I'm talking about. And he was able it wasn't as big of a deal as the other doctor was making it. He went in there, little kiss of the balloon, little stent in the iliac, and she's doing great, full blood flow, fully back on her feet because she was that the poor lady, she was not doing well at all. She had rest pain, it was waking her up at night. She couldn't even walk a few feet. She was trying so hard. And this made all the difference in the world. So thank you, Heinz, for all of your encouragement and taking the time with that member of our group.
Yeah, no problem. I have no questions really. I just listen.
Oh, there's a great wisdom to be gained from silence. I agree.
Yeah, have you tried any of the P.A.D 100 or yoga toes or you know, any thoughts on
living at 6,400 feet, you know, walking in thin air. So that adds to the fun in walking.
you
Plus,
what? I didn't quite.
Well, I live at 6,400 feet. That makes
Oh,
walking a lot more fun. Your heart has to pump a little more,
yeah,
you
it
know?
does.
And with that, I have hills. There's nothing flat around here. It's all hills. So I walk
Yeah.
hills.
And where are you again, Heinz?
Colorado.
Oh yeah, there's some. Well, it wasn't you? I thought it was in Scotland. No, that was someone else. Yeah, that was somebody else. Where in Colorado?
Colorado Springs.
Oh yeah, I interviewed in Fort Collins. Nearly went there years and years ago. It was beautiful because you turn left and you could see the mountains. Turn right and the plains. It was such a weird contrast.
Exactly.
Really beautiful.
Yeah. We're just happy we have nice weather to walk in outside.
Right. A lot of
Right.
triathletes train out there in up in the mountains and stuff. Quite a few people I know have trained out there.
Colorado Springs actually has a neighboring town called Manitou Springs, and there is the old cog railway, an incline that has 60% 60-degree hill
Great.
that
Damn.
people exercise on. I did it years ago a few times. It's about a mile long, and that's what they do to get trained. Plus you're going from 7,000 feet up to, I don't know, 8,000 some feet.
Man, that is serious
So
training.
it is. And then there's Pikes Peak right in front of us, and you can walk 13 miles up and 13 miles down. That's a
Right.
marathon, also Pikes Peak Marathon, which in summertime is run.
Oh man, coming down and not ruining your knees, that would be tough.
Yeah, everybody thinks coming down is easy. No, it's not. I mean,
coming down is worse.
I've never done the full up and down. I've gone up and I was picked up on the top, but I've only gone halfway up and then walked back down. You're right. It's murder on your knees.
Yeah, you have to know how to do it. I mean, I've done a lot of marathons and races and stuff, but coming down is a real art because it strains your quads and your quads get tired, and before you know, you're beating up your knees, and then you can split a meniscus or something. So actually, you have to be very careful coming down, especially if it's a long downhill.
Yeah.
Interesting. Anyway,
Yeah.
Kim, I'm getting really hot in this truck. I'm gonna have to
Yeah,
open
I
the
was just going
window.
to say we're coming up on the hour here, and I think this was a really valuable one. And it's so funny because before we
Man.
started this, Kevin, we were talking about discussing obstacles to walking in the winter and to getting the exercise in the winter. And we covered so much more than that. And we appreciate Karen for sharing her story and the conversation that you had with her to help her in her walking journey to maybe improve her results. That was incredible. But I think next week, I think it would be timely to talk about all the obstacles or should we call them excuses as to why you're not walking this winter, particularly as we go into the holidays. Everyone always makes excuses as to why they cannot walk because they're so busy over the holidays. And then come the week of Christmas, I get so many calls on our hotline from people who have refrained from walking over the course of the fall because they were too busy and suddenly they need an urgent intervention. So I think we need to encourage people to start now. Although we don't mind those calls, please always call the hotline to get help. But 1-833-PAD legs, LEGS, make sure to call. But start walking now. Make it a daily habit. Make it part of your busyness. I know it's hard when you have the flu or a cold or whatever, but let's talk about this next week, Kevin, and do a little thinking on it of maybe a regiment that we can do because it is hard to get out and walk when it's raining outside or when it's snowing. Maybe people don't have that treadmill that we'll help people find one if they need help finding one or getting one to do it in the house. But maybe exercises, we can go through the P.A.D 100 and other exercises that people can do if they can't get outside or they're not feeling good. It's still, especially when you're not feeling good, it's really important to do some circulatory exercises. So I remember
Mike just mentioned walking. I see a lot of people doing that here.
Yep.
Irrespective of the
Walking is
weather.
really great.
And you
And
meet other
I
people.
might even give a call to Walmart. I might ask them if we can do some sort of partnership over the winter and see if we can, you know, get an allowance for people, you know, who have PAD and need to walk to be able to walk the aisles of Walmart as long as they don't disturb, you know, the shoppers, the people actually spending money. But I'm sure they wouldn't mind. It's a big store and you can get a lot of laps in and get a lot of steps in, you know, just walking the aisles. So that's really important. I might do that before next week. But I think next week, let's talk about some variations in your exercise regimen. If you're sick, if you do have a cold, if you do have the flu, whatever it might be, if you're busy, maybe some different exercises. I think I did a video. Maybe Joshua, our producer, could remind me. I think I did a video last year of how you could get a few extra circulatory exercises in while you are shopping. So I'll have to find that video and maybe we can run that as well. And Kevin, if you know, have another video that you can do in the next week that we can use next week on the show of some of these additional exercises that people
Well, I
can
have a
do.
video showing a lady walking in the mall. She was
yeah.
actually working out in the mall and it's using whole body, you know, whole body video. That was pretty good. So
Josh is going to make me go back to the store. He just messaged, he's going to make me go back to the store and do another video on exercising in the supermarket.
it's also very helpful if people ask questions, because there's nothing like teaching to teach you your subject, because people ask questions and you're forced to understand it enough to teach it. So Karen's questions were quite useful for me because, I mean, I know how to do it my way, but teaching it, you know, is quite challenging actually. So that's good. It's got my mind turning over.
Good. Well, awesome. Thanks everyone for joining us. Make sure you do go to Amazon and do a search for Kevin Thomas Morgan. Check out all of his different books. They're really incredible, especially his new one with the P.A.D training program. It's worth taking a look. You can, it'll, if anything, it'll be a great conversation piece to bring to your doctor and have with your doctor to determine the right exercise regimen for your specific situation. It'll also probably educate your doctor a little bit more on some other options that might be available to help people improve their circulation or turn their walk into a more effective blood pumping program by reading his book. You can also go to inspirationalselfhelpbooks.com or also his YouTube channel. You can subscribe to his channel as well. It's youtube.com/the @ fit old dog. Make sure you do go to his channel. Also, like this video and subscribe to the video. It really helps us out a lot. Click the notification button to get notified when our next episode of Collateral Nation is live. Thanks everyone for joining us.
Thanks, Kim.